Do you want to be able to think more clearly without making errors? Do you want to have a clearer and more methodical way of thinking that helps you get to a right decision in your life? Then you're going to love the upcoming explanation of various psychological phenomena with regards to logic and biases, and more importantly, how we can protect ourselves from erroneous thinking. I want to focus on a few relevant logical fallacies or cognitive biases, and I'll explain what these terms mean, that are relevant to all of our lives on a day-to-day basis, but also has relevance to health and healthcare decisions. Now, what do either of these mean? A logical fallacy is defined as a common error in reasoning that can, but not necessarily always, lead to incorrect conclusions. A cognitive bias is defined as a systematic error in thinking that occurs when people are processing and interpreting information. Essentially, both of these, logical fallacies and cognitive biases, are examples of erroneous thinking and not in keeping with science, logic, or medicine. The first logical fallacy we come to is called the bifurcation fallacy, also known as a false dilemma or false dichotomy. This line of reasoning is wrong because it limits the options to two when there are in fact more options to choose from, often a spectrum. An example of this was when George Bush famously said you're either with us or against us when he wanted to invade Iraq. This kind of rhetoric fails to recognize there is more than one way to skin a cat. Some people can just be neutral or uncertain. Doctors and clinicians often fall into this trap, for example regarding vaccines. You either accept the science and vaccines or you're a complete moronic anti-vaxxer, when in reality there's a whole spectrum of uncertainty and hesitancy that is possible. The bandwagon effect. This is the tendency to do or believe things because many other people do or believe the same thing. A vivid example of this is during the COVID-19 pandemic. For whatever reason, people started hoarding toilet rolls. No one really understood the logic of this, but because others were doing it, so did many other people. The boomerang effect, or the theory of psychological resistance. This refers to the unintended consequences of an attempt to persuade, resulting in the adoption of an opposing position instead. It states that attempts to restrict a person's freedom often produces an anti-conformity boomerang effect, i.e. they end up doing the opposite. Examples of this include parents trying to put strict curfews on teenagers. They feel they are now adults and often do the exact opposite of what their parents requested. Confirmation bias. This is the tendency of people to search for or favor information that confirm their pre-existing beliefs or hypotheses. For example, a cannabis user will likely type into Google the benefits of cannabis and will more likely look for benefits rather than researching the harms. The internet and algorithms behind social media platforms have certainly increased confirmation bias by providing users with more information similar to what they have already read and liked previously. Biased assimilation. This is similar to confirmation bias but less known and a little bit more complex. Essentially, you accept information that favors your beliefs without questioning it much, but very much critically evaluate evidence that challenges your pre-existing beliefs. This is different to confirmation bias, which essentially just searches for information that supports your beliefs. In biased assimilation, you are also looking to dismiss what doesn't support your pre-existing beliefs. False consensus effect. This happens when someone stays rigidly within groups that share the same beliefs, results in overestimating the number of other people that share our opinions, beliefs, and behaviors. For example, anti-vaxxers may think that most people are against vaccines because of the discussions and groups that they are involved in. In reality, 92% of the people worldwide support vaccines. Ultra-crepidarianism. This is a tendency for people to confidently make authoritative pronouncements in matters above or outside one's level of knowledge. Again, for example, when issues of vaccines come around, you suddenly have people who have no medical or scientific background but suddenly feel they have the ability to analyze postgraduate research level data on the topic. This is similar to someone with no background in physics criticizing Einstein's theory of relativity, or a coffee shop worker feeling they can operate a space rocket based on watching a YouTube tutorial. Appeal to nature. The appeal to nature logical fallacy basically says that something is good because it's perceived as natural or bad because it's perceived as unnatural. But this is an error in thinking and not in keeping with science and medicine. For example, antibiotics or strong pain relief medications which are synthetically manufactured in a factory are not exactly natural, but they do work. The optimism bias. This is a cognitive bias, i.e. an error in thinking that states that generally we tend to be too optimistic for our own good. For example, we don't think we ourselves will suffer from cancer or a heart attack, whereas in reality both of these are very high risks for anyone. The next phenomenon we see in play is called the compassion fade, which states the level of compassion decreases with an increased number of unidentified people suffering from an ailment. Conversely, compassion increases when you have a small number of identifiable victims. 1 million civilians killed in Iraq without a name or faces or any details don't generate much compassion, but 2 individuals stabbed on London Bridge, and when you interview their families and details are given and pictures are put up on the news, generate more compassion than 1 million civilians on a remote part of the world. Both are wrong, but less compassion is generated for a large number of unidentifiable victims. This is the compassion fade. Metathesiophobia, the fear of change. It is natural to want routine, to resist any change to our environment, but when it becomes persistent and irrational, and particularly when it's at odds with research and evidence, it can become dangerous. For example, Mahatma Gandhi rejected antibiotics for his wife when she was ill because it was new and didn't want change, and unfortunately she passed away sadly after that. The lowball, this is a sales technique you should definitely watch out for. This is essentially where a salesman makes you a lower offer than the actual price, for example £150, but then later on says, oh, it's £200 because of tax charges. You're more likely to be committed at that point and go ahead with the purchase regardless. So there we have it, a number of logical fallacies and cognitive biases that you should be aware of. If you have found anything useful in this video and would like to continue to keep learning about psychology and health, be sure to smash that subscribe button. Until next time, take care.